my name is Laura Harold Madsen, and I'm here to talk to you guys about climate change and West Nile virus and how you can communicate to the public during an outbreak, as well as how to communicate prevention. Now, let's talk a little bit about West Nile virus. What is it? It is the most common cause of mosquito-borne illness in the U.S. And it's summertime. And summertime means mosquito bites. More people outside, more people doing more active stuff, and more people get bit by mosquitoes. So in the average in the U.S., about 2,200 cases of West Nile virus reported each year with 225 deaths. And most are reported between the summer and fall. It just takes one bite to infect you, and it can be deadly. So climate change is expected to impact geographic and seasonal patterns for West Nile virus. And this means broader areas can see West Nile virus, as well as longer seasons, so it can last a lot longer. Now, transmission. How is it transmitted? We all know if we get bit by a mosquito, we could have West Nile virus. However, let's talk about it. So West Nile virus is actually not from mosquitoes naturally. It's in birds. Birds are a natural host and reservoir for West Nile virus. And birds are the only species that can actually get viral loads up strong enough, large enough to give mosquitoes the infection. And then that infected mosquito, after it feeds on the bird, actually comes and bites a human, a horse, another animal, and it becomes infected. There's currently no vaccine for West Nile virus. Now, what are the symptoms of West Nile virus? Only about 1 in 5 people infected with West Nile are actually going to show any symptoms, and they range from anything from fever, headaches, body aches, joint pain, vomiting, diarrhea, rash, and ultimately can end in death. All these West Nile needs to be confirmed by a medical profession. Now, when we talk about who is at risk, anyone over 60 is at a greater risk. People who have cancer, diabetes, hypertension, kidney disease, people who've received organ transplants, all these people are more susceptible to getting West Nile virus. And the scary thing is, I think that we all know someone in one of those categories. So the West Nile virus was first discovered in the U.S. in about 1999. In 2021, Maricopa County, Arizona had the largest outbreak in U.S. history, with 1,487 cases reported. So if you think about this, in 2021, we had about a little over 331 million people living in the U.S. So the average cases reported in the U.S. is 2,200. Maricopa County had about 4.95 million people living in them, with 1,487 cases reported and 101 deaths. So this is a increase in numbers and considered an outbreak. So public health officials interviewed clinicians as well as patients, and really what they discovered is a lack of awareness about West Nile virus and the outbreak in general. So Maricopa County Health Agency really showed the need for awareness of West Nile virus and prevention methods. So the Maricopa County public health officials increased their outreach to community and providers through messaging, education events, and media, and had a lot of success. So without an available effective West Nile virus vaccine, the best way to prevent the mosquito-borne illness is by preventing the bite. This can be accomplished through community-based programs as well as personal protection behaviors. So when we talk about community outreach, we're going to talk a little bit about community understanding, community mobilization, as well as cultivating relationships. As far as community understanding, utilizing platforms and task force to really let them know about, understand the importance of mosquito control operations using insecticides was one critical point. Addressing concerns about safety, environmental impacts, as well as surveillance methods can help people understand and benefits of these controls. As far as community mobilization, this involves behavior change and promoting the need for community assistance. And this can be done by reaching out to church groups, doing community cleanup days, doing educational material handouts, just really involving the citizens in prevention activities and really validating the importance of personal prevention. And then cultivating relationships. I mean, this is social media, training your staff, making sure press releases are clear, and really looking at what partners you could. Do you partner with a screen company that puts screens in windows? Do you partner with an insecticide company? Do you partner with a insect repellent company? These are a lot of sources to look for. As far as personal protection measures, this includes like wearing long sleeve shirts and long pants, limiting outdoor exposure during high mosquito activity areas, using air conditioning, installing windows and door screens, reducing mosquito breeding sites, so standing water, any standing water you have in your area, please get rid of. That is a breeding site. So with the information we have learned, especially through the Maricopa County outbreak in 2021, is that education can really prevent the West Nile virus spread. And we may not be able to control the climate change, but we can control how West Nile virus is transmitted and prevent future outbreaks.